Hello everyone. Today we will talk about the blood pressure, that is the last component of the vital sign. So we will see what it means. So first of all, introduction. So blood pressure is defined as the lateral pressure on the wall of the artery. So here what it means, one kind of pressure that is creating by the heart. Okay, so that is what the lateral pressure on the wall of the artery. So that pressure will be the on the arteries of the heart by the flowing blood under the pressure from the heart. So this is what this heart is going to create one pressure. So how fastly the blood is circulating into the artery. So that force is going we are going to count as a blood pressure. So systematic or the arterial blood pressure in the system of the artery in the body is a good indicator of the cardiovascular health. If whatever this is the pressure, we can say, or the how well forcefully this blood is circulating inside the system. If everything is working very nicely, then that is a good indicator that the cardiovascular system is working very good. Then after, blood flows throughout the circulatory system because of the pressure changes. So blood flow. So here when the blood will pump inside the heart, that time the flow won't be the same at all the time. They will be fluctuating. So through this blood will flow throughout the circulatory system because of the pressure changes. So when it comes to the heart, that time maybe the blood flow will be higher or the greater, but when it comes to the peripheral area, that time the blood flow will be less. So it moves from the area of high pressure to the area of the low pressure. So that is how it is going to circulate. Where it is where there are the more pressure, from there it will go to the less pressure area of the organs. So here the heart contraction forces blood under the high pressure into the aorta. So here we are talking about the aorta, that is a part of the heart. So that is one which is containing or which is circulating the high amount of the oxygenated blood. So that is what the heart is going to contract, and whatever the four chambers are there inside the heart, that will filled with the blood. So that will be forcefully come into the aorta. So the peak of the maximum pressure when the ejection occur is the systolic pressure. So when it will reach to the peak level of pressure, so that is considered as a systolic pressure of the blood pressure. When the ventricle relaxes, so in the heart there will be the four chambers, two ventricles will be there, right? So this ventricle, when they are relaxing, first that will be filled with the blood. When they are ejected into the aorta, that time they will be relaxing. So the blood remaining in the arteries exert a minimum or the diastolic pressure. So now the ventricle relaxes, and that time the few amount of the blood will be remaining inside the ventricles, and even though in the arteries also. So again one pressure is going to create. So that is known as a diastolic pressure. So diastolic pressure is the minimal pressure exerted against the arterial wall. So here we can say that there are the two type of pressure, that is the diastolic and the systolic. So systolic is the one which will we will consider as a peak one, and the diastolic is the one that will consider as a minimum. So that is a minimum pressure which is excreted or the discharge, we can say, during the arterial wall. So blood pressure is divided into two types. There are the two types are there, as I said earlier, systolic and the diastolic. So here we will talk a little detail about that. So in that first one, systolic blood pressure, when the left ventricle contract. So here we are talking about the ventricles. So when left ventricle will contract, so what happens, pushes the blood into the aorta. So after that, when the left ventricle will filled with the blood, it will contract and it will give the blood to the aorta. And the pressure produces is called the systolic blood pressure. So when it is going to the aorta, so one pressure will be created inside the heart. So that is considered as a systolic blood pressure. So its value is 120 mm of Hg. So this is we can consider as a normal or the baseline or normal value for the blood pressure. So systole will have the 120 mm of Hg. Now we'll talk about the diastolic blood pressure. When the complete cardiac diastole occur, a heart is resting after pushing the blood. So what happens when the complete contraction will be there, and once the blood has gone to the aorta, so after that the muscles of the heart, they need to rest. So they will go to the next level, that is a relaxation. So all the muscles will go for a few seconds, it will go for the relaxation. So again another pressure will be created inside the heart. So that is considered as a diastolic blood pressure. So the pressure within the arteries is called as a diastolic pressure. It is about the 80 mm of Hg. So the blood pressure is measured by the sphygmomanometer. So that is the one the tool, or we can say the equipment. By using that we are going to assess, or we are going to check the blood pressure of the patient. So the standard unit for the measuring blood pressure is the millimeter of the mercury. That is what mm of Hg. So this is the universal standard unit, we can say. So this is the unit we will use for measuring the BP or the blood pressure. So the measurement indicates the height to which the blood pressure can rise to a column of mercury. So the column of mercury, that you will be able to understand in the later stage. So how much this mercury is rising, the column of mercury, if it is rising, they will be showing the perfect diastolic and the systolic pressure. So blood pressure is recorded with the systolic reading before the diastolic. So here what it comes, first will come the systole, then after it will come the diastolic. So systolic is the one which heart is going to create the most sound. So that is a systolic, and the diastolic is one pressure or one sound which is making the heart. So that is considered as a diastolic. So as we have seen earlier, systolic will be the 120 mm of Hg and the diastolic will be the 80 mm of Hg. So the difference between the diastolic and systolic pressure is known as a pulse pressure. If we want to know the pulse pressure of the patient, that time what we have to do, we will have the diastolic and the systolic pressure. So here the formula has been given. The pulse pressure we want to know. So here we will take the systole and the diastole. So whatever the amount of the systole is there, here the example has been given. For example, a blood pressure of the patient is 120 by 80 mm of Hg. So pulse pressure will be the 40. So here what we are going to do, we will take the systole pressure and we will do the minus of the diastole pressure. So we will have the pulse pressure. So it's like if the pulse systole is the 120, so minus diastole is the 80. So here we will do like this and we will get the 40 mm of Hg. So that will be the pulse pressure. Okay, so here there are the sound of the pulse, we can say. So here the phases has been given. So phases of the Korotkoff sound. So what is that, we will see. So in that total there are the 5 phases are there. So first we will talk about the phase 1. So pressure level at which the first faint and clear tapping sounds are heard, that is a systolic BP. So here when we are attaching the BP cuff to the patient's arm, that time what we have to do, we have to use certain kind of equipments like the sphygmomanometer, and we are going to use the stethoscope. So what we will do, we will apply the BP cuff over the upper arm of the patient. Okay, and from the brachial artery we will on the brachial artery we will keep the stethoscope, the diaphragm over it. Okay, so that time we have to try to listen the beat of the heart, the heartbeat or the pulse we have to feel. Okay, so if at that time if we are listening the tapping sound, so that is a clear tapping sound are heard. So first you will listen this kind of sound, that is known as a phase 1. Okay, and that shows the systolic pressure of the blood pressure. So sounds gradually increases in the intensity. So when you're listening that pulse sound, that time what happens, the sound will be gradually increasing. So that is about the phase 1. Then after we'll talk about the phase 2, that is the murmur or the swishing sound are heard. So here what happens, the sound is going to the sound will be a little weak. Okay, so that is known as a phase 2. Then after phase 3, the sounds are sharper, more crisp, and the increase in the intensity. So here what happened, the sounds is going to become a very sharp you will listen the sound. Then after it will have a very clear sound, and again the intensity is going to increase. Then after phase 4, so that is a distinct, abrupt, and the soft sound is heard. So again the here this every sound we are talking about, that is about the pulse, or that is how you will be listening. So that will be like distinct, we are listening very the sound which will come, it will be like abrupt or very soft sound will come. As we are listening something from distance, so that kind of sound you will be able to listen. Then after the phase 5, last sound is heard. So here what comes, it is the last sound of the whatever we are hearing, like the pulse we are listening right on the stethoscope. So that time the last sound you will be able to listen. So that indicates the diastolic BP. So that contains both the parameters or both the readings we can say, that is the systolic and the diastolic. So after which all the sound disappear. So after that what happened, all the sound will disappear, no sound you won't be able to listen. So there are the total 5 stages are there. So here the one picture has been given. Here you can see that is a phase 1, that is known as this is the scale which you will be able to see on the sphygmomanometer. So when we are taking the manual blood pressure, that time we will use the sphygmomanometer. So that time you will have a one scale over that. So like that they will be showing. So 140, 130, 120, 110, 100, 90 and the 80 like that. So when the blood pressure is the mercury will be inside, will be here between this. So that will go up. Okay. So that is the first phase. If you are, here also you can see how they are showing. Okay. So the pulse or we can say the sound will be a very sharp. Then again, what it is, you can see the this sign also. So a blowing and the wheezing sound. So a sound will the sound will be a little loose, or we can say the wheezing sound we can be there, or the murmur sound. Then after again what happens, the intensity is going to increase. So again there will be the sharp sound will be there. So that is what. Then after that is known as the third phase. Then after the fourth phase, that is what a softer blowing sound that fades. So here what happens, again the intensity is going to be reduced, and again the sound will be little soft. So that is the phase 4. Then after what happens, all the sounds will fade away. So that is known as a silence. So that is the phase 5. So these all are the phases which we have to remember. Okay. So now we'll be talking about characteristic of the blood pressure. So in that, what kind of characteristic will be there inside the blood pressure? So first we will talk about the cardiac output. So it is a volume of blood that pumped by the heart into the 1 minute. So during the heart pumping is there, and during 1 minute how much heart is getting the blood. So that is known as a cardiac output. So cardiac output can increase when there is a more amount of blood pumped by the heart ventricles. When the ventricle of the heart, they are getting more amount of the blood. So that time what happened, the cardiac output is going to be increased. So increased cardiac output can increase the heart rate. So what happens, if the cardiac output is more, it means the amount of blood is more. So what happens, the heartbeat or the heart rate is also going to increase. Okay. So why it is like that? Because the heart is getting so much amount of the blood, more amount of the blood is there. Okay. So what happens, the heart is going to work extra little. So that's why the heart is beating much. So that is why if the cardiac output is more or increase, that time the heart rate is also going to increase. And the blood volume which causes a rise in the blood pressure. So what happens if the cardiac output is more or the increase, so that eventually going to affect the blood pressure of the body also. So what happens if the blood volume and the cardiac output is more, so blood pressure is also going to increase. So increased heart rate increases the heart contractility and the decrease the heart feeling time. So what happens here, when the heart rate is more, so that time what happens, the relaxation and the contraction and the relaxation, this both the mechanism, they are going to get little disturbed. So heart it contracting more, okay, but they are not getting time to relax. So that's why what happens, they are the heartbeat will be more also, and the filling time, the ventricles and the aorta and everything, they will get little time for refilling. So that's why it is going to have problem. So decrease the heart rate time, and as result of the blood pressure is decreased. So eventually what happens, the blood pressure is also going to decrease. Then after peripheral resistance, so what it is, so blood vessel is made up of smooth muscle that contract and relax to the cause flow of blood into the blood vessels. So here we are talking about the blood vessels, okay, the one who is containing the blood or who is carrying the blood. So that all the blood vessels is made up of the smooth muscles. So what happens, that will contract and relax. So contraction and the relaxation will be there. So by that it will cause the flow of blood into the blood vessels. So by that the blood will be filled inside the blood vessels. So any change in the lumen of the blood vessel, so there will be the if we are talking about the blood vessel, so that like this blood vessels will be there. So lumen, so this is the called as a lumen. So here any changes in the lumen of the blood vessels like obstruction, okay, so any obstruction is there or any disturbance is there between the lumen, so what will happen, so can cause the rise in the peripheral resistance. So what happens, the peripheral resistance will be there, which increases the blood pressure. So by that what happen, if the obstruction is there, so because of that the this blood pressure is also going to increase. So when the blood flow is decreased, there is a decreased peripheral resistance and fall the blood pressure. So what happens if peripheral resistance is more, so that time the blood pressure is also going to increase, but peripheral resistance is less, then the blood pressure is also going to fall. Now we'll talk about the blood volume. So the volume of the blood in the vascular system affect the blood pressure. So here again the volume, how much amount of blood the heart is getting, so that is also going to affect the blood pressure. So when the blood volume is increased, that create the constant rise in the pressure within the arteries. So if amount of or the ml of the blood is more, so what is going to be there, the pressure will be more over the arteries. So eventually the blood pressure is also going to get rise. So which increases the blood pressure when the circulating blood volume falls. When the circulating blood, so if the blood is less, so what happens, in the case of the hemorrhage and dehydration, blood pressure also decreases. In the case of the hemorrhage, it means the loss of blood. So if any accidental injuries are there or any cut is there, so what happens, there will be the they will lose the amount of the blood. So there is a, if we take the example, if there are the 400 or 500 ml of blood is there inside the body, if 200 ml of blood has lost from the body, then of course that amount is going to also decrease, right? So that the heart is only going to get the 300 ml of the blood. So what happens, the blood pressure is also going to get reduced. So that is what, if blood volume is increased, so blood pressure is also going to increase. If blood volume is less, then blood pressure will be reduced. Then after the viscosity, so thickness of the blood also affect the blood pressure. So here the blood also have the one consistency. If it is so thick, then of course it is going to have a problem. If it is so much thin or like a watery or something, that also going to have a problem. So it should have a complete consistency. Okay, so here we are talking about the viscosity. So thickness of the blood also affect the blood pressure. So if blood is thick, so that is going to create a problem. So the percentage of the red blood cell in the blood determines the viscosity of the blood when the thickness of blood increases. So here what it is the main composition, that is the red blood cell. So percentage of the red blood cell in the blood determines the viscosity. So that is how we are able to understand the thickness of the blood. So what it means, determine of the blood when the thickness of blood also increases. So it causes a rise in the blood pressure due to the increased pressure of the blood vessel to contract. And so here what happens, the thickness of the blood is there. Okay, so due to that they will have a more resistance or more pressure over the arterial wall. So that is also going to increase the blood pressure. So when the viscosity of circulatory blood falls, the blood pressure also going to decrease. If this viscosity, if it is a less, then what happened, the blood pressure is also going to fall. So now we will talk about the elasticity. Normally the arterial wall are the elastic which help in the forcing of blood into the arteries. So here we are talking about the elasticity. So elasticity of what? The arterial wall. So arterial wall, they have one kind of elasticity. So by that the blood is going to pump into the another organ or somewhere else. So here what it is going to do, it will help the forcing the blood into the arteries. So as the pressure in the artery increases, if the pressure is going to increase, so the elasticity of the wall are lost. So if more pressure is coming, so what happens, the elasticity will be lost, which cause the distension of the arteries. So what happens, the arteries is going to get distended. So arterial distension can cause the fluctuation, so that is the changes in the blood pressure. So if elasticity is lost once, so what happens, the reading of the blood pressure will be also get fluctuate. Okay, so that was everything about the characteristic of the blood pressure. So now we'll be talking about the factors affecting the blood pressure. So there are several factors, due to that the blood pressure is also going to get affected. So in that, first one is the blood volume. So blood pressure is directly proportional to the volume of blood. So as we have talked earlier, the how much blood volume is there, that is also going to affect the blood pressure also. So how much volume of the blood in the cardiovascular system? For example, in case of the hemorrhage, shock or the dehydration, there is a severe loss of the blood that will lead to the decreased blood into the arteries. So eventually causes the low blood pressure. So it is that is what we have talked earlier, when there is a case of the hemorrhage, shock and the dehydration. So these are the condition where the patient is going to lose so much amount of the blood. So eventually what will happen, the blood volume is decreased. So due to that the arteries of the body, that will contain the less amount of the blood. So eventually the heart will get the less amount of the blood. So eventually what happens, the blood pressure is also going to drop. So whereas condition like high salt intake will lead to the water retention, that will increase the blood volume. So if patient is taking so much of amount of the salt, so that is the sodium is going to increase the inside the blood. Okay, so sodium is the one which will cause the edema also. So the sodium level is more inside the body, so what happens, water retention will be there. So that also going to be increased blood volume, because why, that water is going to absorb by the blood. So eventually that also going to get increased and ultimately increase the blood pressure. So in the case of the patient have the sodium level is more, then that is also going to have a effect on the blood pressure of the patient. So then after the cardiac output. So what is that? Cardiac output is the volume of the blood ejected by the left ventricular per minute. So what it means that this ventricle is going to get the blood, and per minute how much amount of blood they are discharging into the aorta. So that is known as a cardiac output. So increase in cardiac output causes increase in both systolic and the diastolic pressure. If the cardiac output is more, then what happens? The blood pressure is going to get more. So systolic and the diastolic pressure will be more. So then after the age, so age factor is also going to affect a lot the blood pressure. So a person blood pressure reading tend to increase as he grows older. So when the person is getting older, that time what happens? They will have the blood pressure is also going to more. So as we used to say that the person who is older or who is aged people, they are the geriatric patient. So they have the blood pressure will be more for them. Okay, so that is what the age is also going to affect the blood pressure. Then after the gender, so men tend to have a higher blood pressure than the woman of the same age. So here if we talk about the gender, so gender is also going to affect the blood pressure. So men will have a more blood pressure than the woman if they are sharing the same age. Then after the physical fitness, so people who are physically fit tend to have a more normal blood pressure than the people who are out of shape. So the person who are physically fit, so we can say the whose BMI is a normal, basal BMI is for whom it is a normal. So for them the blood pressure will be okay, it will be a normal. But when it comes to the people who is obese or those who don't have a proper BMI, so what happens? Their blood pressure is going to be increased. So that physical fitness is also going to affect the blood pressure. Then after the obesity, so people who are overweight usually have the higher blood pressure than they would if their weight was close to their ideal weight. So obese patient, so obesity also going to have, so we can say the weight of the patient. If they are obese, so what happens eventually in that the cholesterol and the fat level is going to increase into the arteries. So by that the obstruction will be there, accumulation of fat will be there, deposition will be there. So by that they will due to that the heart is going to pump more, and by that they will get a little time, ventricle will get little time to refill this blood. So eventually blood pressure is going to be increased. Then after the pain, the brain may respond to the pain by the increasing the rate and strength of the heartbeat. So if we have pain at somewhere or sometime we have cut, or if we have got the bruises or something, or we have some accident or something, so what happens that time we will have the pain. So what happens, brain will send the impulses to the heart, and what they will do, they will pump more. So eventually what happens, the heart rate is going to increase. As we have seen earlier, if the heart rate is increased, then what happens, the blood pressure is also going to increase. So the increased rate increases the amount of the oxygen available to the muscle for producing the energy. So what happens, why the heart rate is increasing? Because that particular muscle or particular organ or part need more oxygen. That's why heart is pumping more. Okay, so eventually what will be that will result into the increased blood pressure. Then after the emotion, that is another factor. So fear, worry, excitement and the similar emotion can result in higher blood pressure. If we have certain kind of this kind of emotion, like if we have a fear, if we are thinking so much, if we are taking so much tension, or we have so much excitement, that time our blood pressure is going to affect. So in this kind of condition, our blood pressure will be increased. So the brain may react to this emotion in basically the same way that it reacts to the pain. So as we have seen the earlier factor, that is a pain. So how our body is giving response to the pain, same way our if we have such kind of emotion, the blood or the blood pressure or the heart is going to respond same way. Then after the gravity, if the person is standing, the blood pressure of the arteries in the lower part of the body will be a greater. So if the person of the human they are in a standing position, so because of the gravity, the lower part of the artery pressure will be more, okay, than the upper part, than the pressure in the upper part of the body. So that is because of the gravity. It means to say that the arteries of the lower part of the body, that will have a more blood pressure than the upper part, if the patient is on a standing position. So position, or we can say the position and the gravity, that is also going to affect the blood pressure. Then after the exercise, a person blood pressure is greater during and just after the exercise, because the heartbeat are faster in order to supply the additional oxygen to the muscles. So here also we can talk if you are doing the exercise, so what happens, the muscles need more amount of the oxygen, okay, because all the energy whatever we have consumed, that has been used as a energy while doing the extra exercise. It means that that other organ also need that proper amount of the oxygen. So when they are not getting, that time heart will pump more. So what happened, heartbeat is also going to increase, and because of that the blood pressure also going to get increased. Then after the disease, almost every disorder that affect the arteries or the renal or the kidney system will result in a higher blood pressure. So we can say disease we can say the illness, if person or a patient is suffering from any diseases, so that is going to affect the heart also, or we can say the arteries, otherwise the kidney, okay. So because of that, all that will result into the higher blood pressure. So diseases that weakens the heart will usually result in a lower blood pressure. So what happens if the disease that weakens the immunity? Okay, there are certain diseases which is going to affect the immunity system of the body. So because maybe they will also affect the heart. So if the heart is also going to weak, then the blood pressure is also going to get reduced. So that is depend on the disease, okay. Then after the drugs. So drugs designed to strengthen the action of the heart, such as the digitalis, will cause the patient's blood pressure to rise. If the person, the drugs, the medication which we are taking, so that is also going to affect the heart also, okay. If heart is going to get affected, then blood pressure also going to get affected. So here the example has been given. So if the digitalis the person is taking, so what happens, that will cause the patient blood pressure to rise. And drugs that cause the arteries to become smaller in diameter, that is called as a vasoconstriction. So here the two process will be there. If that is the arteries become smaller in the diameter, okay, so that is known as a vasoconstriction, and will also cause the patient's blood pressure to rise. If the vasoconstriction are there, okay, so what happens, the blood is going to get that artery will contain a less amount of the blood, but heart need more blood. So what happens, eventually that ratio is going to increase. So then after, drug that cause the patient's arteries to become larger in diameter, that is called as a vasodilation. So that will decrease the blood pressure. If vasoconstriction are there, vasoconstriction, it means the narrowing the arteries, okay, so in that the blood pressure will be increased. If the patient have the vasodilation, so eventually what happens, that blood pressure is going to decrease. Okay, so there are some principles of the BP monitoring. So certain rules and regulation are there while checking or while assessing this blood pressure. So in that, the patient's arm must be at the level of the heart. So when because here we are going to place the BP cuff over the upper arm of the patient. Okay, so that the hand or the arm must be at the level of the heart. So if the arm is below the heart, false elevated pressure are obtained. If it is below the heart level, then what happened? Whatever the result will be there, that will be a wrong. If the arm is above the heart, false lowered blood pressure is obtained. So if it is if the arm is below the heart line, then it also going to have a wrong reading. If it is below, then also it is going to have a problem. Above and below, but it has to be a level of line of the heart or the level of the heart. Then after second, the arm should be supported during the entire procedure to prevent the elevation due to the muscle contraction used to maintain the position. So what happens if we are holding our hand like this? Okay, if we are not providing any kind of support to our hand, so what happens? The contraction and the relaxation will be there of the muscles. If you are not supporting like that, so the muscles will be contract. So by that they will drop down. Okay, the hand will be dropped down. So make sure you are supporting the hand properly during the entire procedure. The cuff and stethoscope should be placed directly on the skin. So make sure you are keeping the diaphragm of the stethoscope directly on a skin. So light pressure should be applied when placing the stethoscope over the arteries. So when we are keeping or when we are placing the diaphragm over the arteries or over the skin, that time make sure you are gently pressing that. A gentle pressure has to be applied. Then only you will be able to listen the heart sound or the pulse sound. The cuff should be quickly deflected to the zero, and once the last measurement is heard, wait a minimum of 30 seconds before the measuring the blood pressure again. So what happened if you have checked the blood pressure once? Make sure you are deflating or you are removing all the air from the BP cuff. Okay, so make sure you are coming to the zero reading. Okay, because till we have seen the scale. Okay, so that kind of scale will be there 180 or 220. So make sure you are dropping that mercury column down. So after that, if you have taken just now you have checked the blood pressure of the one patient, make sure you are waiting for the 30 seconds. Then only go for the checking the again for the blood pressure. So that was the principles which we have to maintain. Then after the preparation of the patient and the equipment. So here what kind of preparation has to be there for the patient and for the equipment. So select the patient. So first of all, select the patient for which patient you want to check the blood pressure. Okay, then diagnose previous blood pressure reading and note the reason of taking the blood pressure. So here make sure you are checking the previous reading also. Okay, because for every patient we are checking the vital sign. Okay, that is no issue. But if any patient is having the hypertension, so that time what happens, we need to see how much the blood pressure has been came to the whether it is a stable or not. Okay, because if the patient is suffering from the hypertension, they will be getting the hypertensive drugs. So whether the treatment is effective or not, that also we have to see. So make sure for which reason you are checking the blood pressure, and the previous result also you should have, so you can compare it. Then explain the purpose of taking the blood pressure to the patient, because here what happens, it will be like every hourly if you are checking, or every 2 hourly if you are checking, but you have to tell or you have to explain to the patient why you are checking the blood pressure. Then only you can win some cooperation from them. So before procedure, check the BP apparatus for the any defect. Make sure if you are going to check the blood pressure for the patient, you are checking the BP apparatus, because sometimes what happen, the mercury that won't be working properly. Okay, so it happens if the equipment has become any breakdown is there inside the equipment. So make sure you are checking the equipment and you are taking to the patient. Then assess the arm on which the blood pressure is to be taken. Then here you have to see on which arm, like left or the right. So make sure you are checking the site for the assessment. So here, do not take the blood pressure reading on the patient's arm if. So there are certain criteria are there on which on that side you should never take the blood pressure. So here some has been given. So first one, the arm is injured or the fracture. If the patient arm is injured or any fracture is there, make sure you are not applying the BP cuff or you are not checking the blood pressure on that side. Then there is a skin disease on the arm. If any skin disease are there, maybe some skin disease can be contagious also. So maybe if you are checking for the one patient and you are going for the another patient, and skin disease can cause to another patient. So make sure you are not doing that. If the patient have certain condition, don't apply the BP cuff and don't check for them. Then after, use the another arm also. So the arm has an intravenous infusion on it. So if the patient have the IV cannula on any side of arm, make sure you are not applying on that. Then on the same arm where the mastectomy is done, if the patient has gone for any for surgery like the mastectomy, so that is a removal of the breast. If the right side has been done, so make sure you are not applying over there. Okay. Then the arm has a shunt or the fistula for the renal dialysis. If the patient is going for continuous dialysis, okay, so one fistula will be there. They will be over the upper arm of the patient. Okay, if it is there on the left hand, make sure you are not applying the BP cuff over that. Make sure you are using the another arm. So this all are the condition, or we can say the criteria for which we should never, or we can say the contraindication for the arm we should never assess. Okay, here the equipment needed to measure the patient's blood pressure. So here, what kind of equipment will be needed to check the blood pressure? So there are the total two kind of equipment has to be taken. One is a sphygmomanometer and second one is a stethoscope. So we will see what it is and how it will work. So the sphygmomanometer is usually called the blood pressure cuff. So that is also another name, you can say blood pressure cuff, otherwise a sphygmomanometer. There are a different type of the blood pressure cuffs are used to assess the blood pressure. So there are a different type of blood pressure machines are available. The digital is also available. The manual is also available. So you can use any of it to assess the blood pressure of the patient. So some are made to be attached to the wall and some are portable. So some BP machines are there which will be attached to the wall. Okay. And some will be portable also. You can take for the every patient also. So that is depend on the policy of the hospital. You can use the equipment. So all the blood pressure cuff devices work basically in the same way. So if we talk about any kind of machine, if we take for the BP measurement, so every machine will have the same mechanism. So have the same parts, it will have the same parts also, like a bladder, a hand bulb with the release valve, a tube connecting to the hand bulb and to the bladder, and a gauze, and either mercury or the anechoic for the measuring pressure or the blood pressure. Okay, here is the one, the sphygmomanometer, the traditional one. This is how it looks. So we will see one by one what kind of parts are there. So first we will talk about the bladder. So the bladder, also called the cuff, is a long rubber bag about the 6-inch wide, that is a 6-inch wide and 24 inches long. Here you can see, this is we are talking about the cuff, BP cuff, or we can say the bladder also. Okay, so that will be the how much? 6 centimeter wide and the 24 inches long is there. So that is covered with the fabric. So if you touch this this part, so that is made up of the fabric. So the bladder is wrapped around the patient's arm and filled with the air when taking the blood pressure. So what this part is there that you are going to attach or you are going to apply over the upper arm of the patient. So the part of the fabric are made up of the non-slip material. Okay. So the material which they are using for wrapping around the patient's arm, that is made up of the non-slip material, because if it is a slippery, then what happens, we won't be able to get the accurate result. So such as the velcro, so that is what they are using, the material, that is a velcro. So when the fabric is overlapped, the two pieces of fabric are adhered to each other. So this is as we have seen, that is about the 24 inches long. So it is a quite long, we can say. So what happens, two wrap will be there, and which will be adhered to each other, that will be stick with each other. So and not slip when the bladder is inflated. So when you are inflating, so that time they will not disattach with each other. So some sphygmomanometer use the snap or other devices to secure the bladder instead of the non-slip fabric, but most probably we will have the non-slip fabric. Okay, so now we'll talk about the hand bulb. So hand bulb is a device for the inflating the bladder. So here you can see we are talking about this one, this bulb part. So that is a hand bulb. So that what we will do, we will take into our into the palm and we will press it. So by that it will create a air or pressure, and that will go to the cuff, and another will be going to the BP apparatus main column. So when squeezed, the hand bulb forces the air through the opening connected to the tubing. So when we are squeezing, when we are pressing it, what happens, that is going to create a air that will go to the tubing, and that is connected. Okay, so when the bulb is released, it refills with the air from the environment. The hand bulb is designed so that the air from the tubing cannot flow back into the hand bulb. So they have made such kind of design that when you are pressing or when you are squeezing, that time whatever the air has been gone to the inside the BP cuff, that will not come back. Okay, so that will not reverse come back to the this hand bulb. So that way they have designed. So then after the rubber tube, one tube is connected to the bladder and the hand bulb. As you can see, one tubing is attached with the hand bulb, and another with this tubing is another with the BP cuff. So air that is forced out of the hand travel through the tube and enter the bladder. So a second tube connect the bladder to the gaze. So that is what this is known as a gaze. So here the another tubing with the attached with that gaze. So now we'll talk about the release valve. So the release valve, that is a screw, is a device for releasing the air from the bladder. So here you can see the bladder is this one is the bladder, and here is the hand bulb. So one screw is there, that is known as a screw, or we can say the releasing valve. So what happens when we are pressing or when we are squeezing this hand bulb, that is going to create the air, and by that the BP cuff is going to inflate. So the air, whatever has been accumulated over the BP cuff, that has to be released. Okay, so how you can relieve that? So by the screw only. Okay, so it is located between the hand bulb and the tubing. So one hand can operate both the hand bulb and the release valve easily. So you can use the one hand for the this releasing valve also. So the valve is controlled by a screw. So that is what this valve is going to control, by the screw only. When the tighten, no air escape. So when this screw is tight enough, that time no air will be discharged from the BP cuff. Okay. So when unscrewed fully, when it is we can say the loosely, if we have done, so what happened, the air escape rapidly. If this screw is not we have tied very tightly, so what happens, the air is going to escape. If it is if we are doing very tightly, so no air will be escaped from the BP cuff. The screw can be turned to any position between completely closed and fully released. So when you will see this, they will have also relieved and the the closed and the fully relieved. In this way, you can also let the air escape from the bladder as quickly or as slowly as you wish. So that is what when we are checking this blood pressure, that time we have to release this air from the BP cuff. Okay, or what we can say, we have to the screw is that we have to release very slowly. Okay, so by that you will have the systolic and the diastolic pressure. So we'll talk about the gauge. Okay, so the gauge measures the air pressure in the bladder. So here that is going to measure that how much air has been inflated inside the BP cuff. So there are the two type of gauge, that is the mercury gauge and the android gauge. So in that first we'll talk about the mercury gauge. The mercury gauge has a column of mercury in the glass tube. So that is what here we have seen. So okay, so here you can see the reading has been given. We are talking about this gauge. Okay, so here they have the glass tube is there in the middle part and they are filled with the mercury. Okay, so the column of mercury measures the air pressure in the bladder. So how much pressure, how much air has been is accumulated inside the BP cup. According to that, we are going to measure the pressure. So the higher pressure of the air in the bladder, the higher column of the mercury. So it means to say how much pressure the hand bulb is there, right? So you have squeezed, so the air has been gone to the BP cup. So how much air you are getting inside this BP cup, according to that the column of mercury is also going to get. If you have given so much air, so what happened, the mercury, this mercury will go to the up level. Okay, if you have inflated a little, so it will be like that and like that, so it will go like this, it will raise like that. Okay, so the height of the column of the mercury is determined by using a scale to side of the tube containing the mercury. So usually there is a scale on the each side of the glass tube in order to make it easier to read the height of the column. As you have seen, there are the reading has been displayed on the either side of the glass tube. So easily you can have a reading of the blood pressure like the systole and the diastolic. So as the air is released from the bladder, the air pressure drops and the column of mercury becomes shorter. So how if you are releasing the valve, so what happens, air will be escaping from the BP cuff. So what happens, the mercury is the column of the mercury is also going to drop down. Okay, now we'll talk about the android gauge. So what is that? So android gauge is a circular and has a dial. So this is the one is known as a android gauge. So the greater the air pressure in the bladder, the farther the needle on the dial rotates. So how much you are squeezing this hand bulb, that is how it will rotate the scale. Okay, so the scale on the dial is equivalent to the scale of the mercury gauge. So both we can say the result are equivalent. Okay, if you are checking with this machine or equipment, it will also have a same as the sphygmomanometer with the mercury one. So both the scale measures the force of the pressure in the bladder in the term of the mm of Hg. So that is what the pressure we are going to measure in the unit of the mm of Hg. So as the air pressure is released, the needle move in a counterclockwise direction and the gauge is normally designed so that it can be attached to the bladder. So that is about the android gauge. Then after, another equipment we need, that is the stethoscope. So the stethoscope is an instrument used for the auscultating the sound produced within the body. So stethoscope we are using why? To auscultate, to listen the sound whichever the body organ or any organ is producing. Okay, so a stethoscope consists of the diaphragm. So there are different parts are there. So in that first one is the diaphragm, then after the metal metal and the rubber tubing and the earpiece. So first we'll talk about the earpiece. So the earpiece are twisted metal tube plastic end. Okay, here you can see this is the tubing, this is the earpin. Okay, this is also tubing, you can say. This is the metal material which is twisted, and that is end with the earpiece. Then after the this is the diaphragm. This called the diaphragm, and this one is the bell. So the plastic piece protect the ear from the metal. So the metal, this part, this is made up of the metal, and this plastic piece is there, that is made up of the plastic. So that can, if it is there, then the metal part won't be able to hurt the ear pinna. So the twisting help to improve the quality of heard through the stethoscope. So the stethoscope be worn with the earpiece forward to help and prevent the sound picked by the diaphragm from the distort. So that is the one which we are putting inside the ear, and we able to listen the sound which is producing from the bell or the diaphragm. So then after the tubing, so the hollow and the metal tube transmit the sound from the diaphragm to the earpiece, and the tubing provide the flexibility. So here what happened, that is a hollow and the metal tube transmit, that is one, the diaphragm is going to produce the sound, and the tubing is the one who is going to transmit the sound from the diaphragm to the earpiece. Okay, and this tubing, that is also helping for the flexibility. Then after the diaphragm is normally flat metal disc that is placed on the body area of being examined. So here you can see this is the diaphragm. So this part we are going to place over the skin of the patient, okay, or the area which we are going to assess. So the diaphragm will pick up the sound produced within the body, such as the heartbeat and the breathing sound. If you are putting over the heart, that time if you are putting the diaphragm over the heart, so we will be able to listen the heart sound. If you are keeping at the lung side, that time we will able to listen the breathe sound. Okay, so that is how we are using this stethoscope for the auscultating. So sometime a bell-shaped listening device is used instead of a flat disc. Sometime we can use the bell shaped machine also, this one. We can use this part also, okay, but that will be listening for the low frequency sound. So some stethoscope have the combination of both flat disc and the bell disc. So most probably there are the stethoscope, they have the two parts over the stethoscope. So sometime they will contain only one, and sometime they will be having the both one for the listening device. So whatever we have seen till now, like the vital sign, we will be showing you the demonstration of each one, that how to check the temperature of the patient, pulse, respiration, and the blood pressure. So this everything will be showing in the demonstration also. So thank you.